Thank you, Mr Speaker. To the Minister of Health, what progress is the government making in providing more surgery for New Zealanders?
The Honourable Tony Ryall.
Mr Speaker, I'm pleased to advise the House that in the last financial year more patients have received surgery than ever before. The number of patients benefiting from urgent surgery rose by nearly 4,000 to over 158,000 patients, and the number of people coming off waiting lists benefiting from elective surgery rose over 8,500 to 138,483. This means that in the last financial year, nearly 300,000 New Zealand patients benefited from surgery in our public health service, the highest number ever.
Nicky Wagner.
Thank you, Mr Speaker. To the Minister of Health, what other reports has he received in relation to delivering more surgical services to New Zealanders?
The Honourable Tony Ryall.
Mr Speaker, the number of patients receiving a surgical specialist assessment in the last year was up over 12,000 on the previous year to over 274,000 patients. This includes an increase of 1,100 patients receiving first specialist assessments in Auckland, an increase of 1,100 in the Bay of Plenty, over 2,000 more in Canterbury, and an increase of over 3,000 patients in the Waikato. This government is delivering more frontline services, especially surgical services, to the people of New Zealand.
The Honourable Ruth Dyson.
How does the additional surgery that the Minister is crowing about of 8,607 compare with the 2008 financial year additional numbers of 11,816?
The Honourable Tony Ryall.
Well, quite clearly this government is increasing the number of elective operations for New Zealanders. And since the previous government, there's about 20,000 extra operations, elective operations, being performed. It's a tremendous record, and that member should stop trying to bring it down.
The Honourable Ruth Dyson.
What's he going to do about the 3% increase? That's more than 2,000 people who were admitted to hospital with preventable conditions revealed in the Ministry of Health annual report year ending 30th of June 2010. 3% increase.
The Honourable Tony Ryall.
Mr Speaker, that is why we're providing more service in the public health service than ever before, with more doctors, more nurses, more operations, more frontline services, and this government is also investing strongly in our home insulation program, where 5 times as many homes have been insulated under this government than under the failed crowd opposite.
Question number 6, the Honourable Nanaia Mahuta.